Every minute, someone goes blind or suffer from an eye-related disease condition that could be otherwise reversible. Imagine not being able to see. In the midst of agony, you will find despair, loss of prestige, and hope. But the emergence of light brings joy. Home to about 150 million people, Nigeria is located on West Africa on the Gulf of Guinea, having boundaries with Cameroon, Niger, Benin, Chad, and 900 kilometers of coastline along the Atlantic Ocean. Shaped by multi-ethnic groups are its diverse cultures, populated by people of varied crafts and workmanship, most of which are rural dwellers who live in communities cut off from basic necessities of life, men and women who toil every day to provide for themselves and their family. I Foundation and Deseret International Community initiative to reach out to the poor and less privileged. In line with the global theme, Vision 2020, the right to sight, I Foundation in partnership with other organizations have carried out expeditions on eye care delivery in communities who would have otherwise remained condemned to life without sight.
The major impact has been the fact that we've been able to reach a lot of people, people who are poor, people who otherwise could not have been able to afford to have quality eye care.
Social marketing field is like public announcement. My role is working with the traditional rulers of every given communities, working with the credible donors and very important personnel within that environment, working with the associations, working with the government agencies and private sectors to make sure that we are able to reach out to these people.
The outreach that goes to those communities are the basis by which we can actually go there and identify the patients rather than waiting for them to come to the hospital. The easiest way is to actually reach out to the people in their communities. We have what we call the Friends of Vision. These are a group of individuals in different communities that are trained to be able to carry out simple eye examination on people in their communities, and through them we disseminate information. We get them to educate the people about the need to get their eyes examined and the need to reach out to the hospitals as soon as they have any problem with their eyes.
Well, public awareness in terms of children, I think the awareness is there. Save a Sight project is a very laudable project that is being organized right now, in the sense that when we talk of barriers to uptake of these available services, awareness, like I said earlier, is increasing. There's a lot of awareness. But in terms of fear of cost, how much is it going to cost to tackle my child's problem, or to tackle my wife's problem, or my husband's problem? So Save a Sight's project is aimed towards taking care of that barrier, which is actually, in a lot of studies done, is a major issue. There is a problem in the rural areas, problem of cost. These people are barely managing to feed. And then a child comes up blind, it's not a priority in the family. A lot of parents assume, oh, the child will grow out of it. Unfortunately, there is an issue with child tackling childhood blindness, especially when cataracts is concerned. Childhood cataracts, the cost to treat one adult, you need 7 times that cost to treat one child. It's very unfortunate because their cataract, the surgery, the management of childhood blindness is quite expensive compared to that of adults. But when you talk of blind person years, you know, you save a child, it's like you saved like 70 adults, really.
Blindness is estimated at about 9 million in the sub-Saharan Africa, with about 3.2 million cases in Nigeria. These are people of all ages who could only imagine what the world looked like and the activities of others living around them. Men who could not work but live in impoverished situations, whose families would suffer as a result of their circumstances, but somehow life goes on. An example of such is a 60-year-old woman who could no longer provide for her family as a result of her sight. In many cases, blindness is caused by something easily reversible, a cataract. Many people are tagged blind, whereas they suffer from disease entities that are reversible. Cataracts and other eye-related problems can always be cured, but only with money, which most people cannot easily afford, especially the rural dwellers.
Most of the activities of the Eye Foundation within the community, whereby about 43% of our surgeries are free in the rural area to the less privileged, and more than 27% of our outpatient services are free, has been solely done in form of corporate social responsibility and is being funded fully by the Eye Foundation Hospital private sector. Over the year, this demand has grown to the level whereby we have the Deseret Community Vision Institute that takes care of the community of over 3 million population free of charge. There's increased demand for our service, but we cannot sustain it. We have other organizations that are interested in these sort of activities, like Deseret International, like C International, Sight Savers, and other eye care organizations. Nigeria has a population of 130 to 150 million, and there are different degrees of blindness. I mean, there are those who are partially blind, and there are those who are blind from preventable illnesses, and there are those who are really blind. Either of them is handicapped in the way of earning a living. And when you say that even if we take our blindness at 1%, that means in this country we have over 15 million blind people in different, either partially sighted or have preventable blindness like cataract or totally blind. The economic implication is colossal. The younger the patient, like in children, the more the economic loss to the nation.
My mother started losing her sight a year and a half before the death of my father. In-laws and relations abandoned her. She was left alone in the hands of God. When her condition became very critical, I had to leave school and my friends to take care of her. My mother's desire is to see me through my education. At the local clinic, she was told that she could see again. The nurse said that she had cataract. Our journey to the hospital started very early in the morning and was quite challenging. It almost came to a stop due to finance. We even had to beg for money to transport ourselves. My happiness is that she can see again. I praise God and I thank God. She can now go back to her business and begin to make enough money to send me back to school.
Success has been that people are more aware about their eyes. People are aware that cataract can be treated. It is curable. It is in fact curable. It can be treated. So blindness is preventable. And if it is cataract blindness, it is curable.
Most of the people that are blind need not be blind. In fact, it's known that 80% of global blindness is actually avoidable.
Self-Decide project is an initiative by I Foundation to increase our output in terms of activities that prevent blindness among the less privileged in our society.